today was really an opportunity that Praxis has made available to us to start this conversation by asking you to introduce yourself just a little bit, because you have a background in the ACT world that is the acceptance and commitment therapy world that is unusual. I wonder if you could just tell folks a little bit about yourself.
I would like to introduce from when I was a child, because I've been struggling quite early with a chronic disease. I had asthma and I was so medicated, and I got obese because of the medicine. And even though I was a very active kid, at that time I was not allowed to move. So pretty much I went through all school time without being able to move, and I was getting bigger and very depressed. So I was quite heavily medicated as a child until the teens, where my mother got the fantastic idea to quit all these kind of medications and try with homeopathy, and pretty much I could start moving and start playing tennis. And then we realized that, I don't know if it's bias effects of all the medicines I got, but I got some rheumatism, juvenile rheumatism. So I had to cut the activity again. And then I went into more meditative. I learned Tai Chi, Qigong, and I moved to a monastery, a Zen Buddhist monastery, where I left quite a long time. And so that was my trip, my way to go into all this. So I studied a lot of things, and I studied psychology, among others, and that was in Argentina. And then I started working in a very, I would say, similar way that we work in ACT, but without knowing what I'm doing. I know I was using mindfulness, at that time was Zen Buddhism. And then I came to Sweden, I moved to Sweden. I realized I got in love with the physiotherapy here because it's so humanistic. So I decided to be a physiotherapist instead. While I was more a body-based psychotherapist in Argentina, here I became a behavioral physiotherapist or physical therapist in America. So now I have 3 masters. One is in physiotherapy, the other is in medicine, clinical medicine, and the other in psychology. And the PhD is in medicine. And you've been there when I was, as we say in Swedish, grilled in my defense.
Some of us just come sort of straight up one path. I mean, I never thought about being a physician myself. The idea never crossed my mind. But for you, it seems like you sort of come up this path where medicine and the body and movement are coming along at the same time as an interest in psychotherapy. So, there's this point, and I know you and I have talked about this, where you had to sort of make this choice, like, do we need a person with psychotherapy senses in medicine more, or do we need somebody with medical sensibilities and body sensibilities in psychology more? And I personally am glad that you made the choice that you made, because I think that the people who have body sensibilities in psychology have not typically been very well connected, I think, to medicine. They've kind of come out of other traditions and from other angles.
You are touching something very special. There are different aspects in this, because when you talk about medicine, I keep thinking, well, today, if we think about epidemiology, what are we dying of? Our chronic disease are all related about how we live our lives. If we are moving, if how we eat, how we sleep, how we drink, smoke, or whatever we do, how many toxins, as you used to say. So all these things are behaviors. You cannot quit smoking with a pill. So all this kind of contagious kind of medicine in the WHO is very clear with the non-communicable diseases. This is very difficult to say in English. That's why now is the time to have the behavioral medicine, where all the behavioral principles has to go together with the knowledge of medicine, and in the service of changing how we live our lives. So as a doctor, if you also are changing behaviors when you want a patient to take or not take a medicine, how to take it. If a doctor prompts you to move, you will do it, which they do with the heart problems, with obesity, with diabetes. So we have reached the point where we really need the behavioral science into medicine. And the important thing is that the medics, the medical professions, doctors, nurses, physios, OTs, need to understand that it's not about to do psychotherapy. It's about to understand behaviors, how can we change behaviors, how can we motivate our patients to change their behaviors. And that's ACT is the only tool I know that really have studied processes that really inform us with precision how to do that. And that was so amazing. So, but we still don't need to do psychotherapy.